All right, so we're going to talk headaches, more specifically migraines, because man, Rand, it's a thing. I deal with these quite a bit from time to time.
You have migraines. I do not, fortunately, but I know a lot of people do.
Right, so Brian is here from Fast Track Physical Therapy. It's amazing to think there are so many different reasons and connections why we might be suffering. I always think, okay, it's just, you know, stress. I'm just going through a lot right now, whatever it is. But there are a lot of other factors too.
Yeah, so obviously I'm here to talk about headaches, migraines, and some of the interconnection between jaw pain, how that can be a contributing factor, how our muscles, when they knot up and tighten up, even our neck can be contributing factors. And then there's tons of different other triggers that may be contributing to headaches, genetics, if you got family history of parents that may have it, weather changes, barometric pressure, foods, drinks, all that kind of stuff can contribute to it as well. But the things that we typically treat in our facility or in our clinics and see great success with are those tension type headaches, those trigger points.
Is this like where the tension is, red?
Like in this case, this would be the sternocleidomastoid, this muscle can cause this headache up in here. The muscles, I don't see the upper trap on this this picture, but the muscles even up in this area up in here, when that knots up, tightens up, goes into spasm, it can lead to the headaches at the base of the head and then come up and over. Yeah, like here, comes up to here, and then up and over. And we can get this ram's horn headache that comes up and over like that.
And see, this is what I wonder if a lot of mine is, because I always feel tension in my shoulders and more specifically in the left side of my neck. And I always wonder, because some people say, do you just need to go get a massage, kind of get that rubbed out a little bit? I mean,
what I normally find, and that can be helpful, but a lot of times the patients that come to see us, they've tried that stuff before. They've tried the migraine medications many times, definitely the over-the-counter deep tissue.
And you know what, Brian? It seems like a temporary fix.
Exactly. And then 3 or 4 days later, it starts to tighten back up again. So we do a technique with our patients that are dealing with more of the tension type headaches or stress headaches. We do a technique called dry needling or trigger point dry needling. So we go into that muscle that's knotted up and tight, and it does an extremely good job getting it to release and relax, and typically stay release and relax. Now one treatment won't fix it, but a few treatments we see great success. I just recently had a patient that's been dealing with chronic migraines, daily migraines for 5 years. She's daily migraine. So it's
I cannot imagine.
And she has only had 2 in the last 6 months since we treated her. So which is very good, very good. So
and you were talking about weather as well, Rainey. I know that's more of kind of your expertise.
Change in pressure, I think.
Exactly, the barometric pressure will change it. I would mention there are seasonal changes. A lot of times that's when we see an uptick of patients coming in and having a lot of vertigo. Now, again, not migraines, not headaches, but they have a lot of vertigo. Great thing about that is we can typically in 2 visits we fix that. Okay, the jaw, and I think you'd alluded to the jaw.
I had TMJ pain as well, which I never really connected the two. And hearing that's like, maybe that's why.
So when you have either TMJ, this is jaw, temporomandibular dysfunction, or a dysfunction in the jaw, so that could be inflammation, so the jaw has become inflamed and it's kind of ticked off, just like any joint, other joint can become inflamed, just like any other muscles in our body, or muscles that we use for chewing our food, talking, even yawning, those types of things. When they're in spasm, that can lead to headaches up in here. So you can see some of the muscles in the face that lead to the headaches up and around the eyes and those types of things. And then also the mechanics of the joint itself. So the joint can become arthritic just like any other. We also have a disc in that joint, and so that disc comes out and is not staying in place. That can be a contributing factor. Sometimes when patients are having a hard time opening their mouth fully, it can be the joint capsule that's restricted, or that disc is not staying in the right position. So we approach treating patients from a multi-faceted approach to get them better, whether it be muscular, decreasing inflammation, restoring the proper mechanics of the joint, and those types of things.
Real quick, Brian, can certain foods trigger migraines?
Oh yeah, most definitely. Foods can, drinks can, alcohol can, red wine can be, and a lot of times that goes back to your genetics. It doesn't mean that those foods are bad for you. It just means that you may have some of those extra sensitivities from maybe a family history, and your body is more susceptible to those. And same thing with environmental changes, weather changes, like we said, that may be related back to even a family history.
They just don't agree with. Man, that's so interesting, isn't it? So many different
go on and on and on.
Yeah, exactly. We can. So,
Brian, thank you so much. Appreciate your help. Fast-Track Therapy.com. Say that 5 times.
Nope, I'm not going to do it here.